If you know the algorithm well, and if you know dermatology well, would you dance for a reel?
Patient feels you like real. They relate to you. You cannot be always in your white coat and talking medicine.
Why is dermatology leading towards so much of body?
The bacteria have become smarter than men. Father had psoriasis and the child comes at a younger age with psoriasis.
What are the suggestions that you give to patients who have moved towards an alternative form of medicine because they've kind of given up on their bodies?
We can use CO2 laser in vitiligo surgeries. We can use eczema laser for repigmenting the vitiligo.
Can these aesthetic treatments, especially laser hair reduction or laser toning, children who are in their teens or preteens, or do you recommend this reach an age bracket where they're adults?
Everybody wants to look younger. But how much and what all do you want to do for?
Are the pediatric needs also the same, or the protocols changes if the patients are below 18?
One drug can be given for multiple conditions. Female can take laser hair reduction anytime 2 years after her first periods.
How is a dermat different in terms of delivering results? तो दोस्तों, आज हमारे पॉडकास्ट में हमारे साथ हैं बहुत ही एक्सपीरियंस और रिस्पेक्टेड डर्मेटोलॉजिस्ट डॉक्टर मोनिका बाम्ब्रू. शी हैज़ डिकेड्स ऑफ एक्सपीरियंस इन क्लिनिकल डर्मेटोलॉजी और आर्टेमिस हॉस्पिटल गुड़गांव की हेड ऑफ डर्मेटोलॉजी हैं. She has clearly excelled in her field with her expertise in diagnosis and treatments of complex skin, hair, nail disorders, management of chronic dermatology conditions एंड पीडियाट्रिक डर्मेटोलॉजी एज वेल. तो आई एम श्योर इस पॉडकास्ट में हमें बहुत कुछ सीखने को मिलेगा, और अगर आप अपनी स्किन केयर जर्नी को सीरियसली लेना चाहते हैं तो ये एपिसोड आप पूरा देखिएगा. सिंस डॉक्टर साहब यू हैव बीन हैविंग डिकेड्स ऑफ एक्सपीरियंस इन क्लिनिकल एज वेल, देयर इज वन थिंग दैट I want to begin with. So what are the underlying conditions that are not diagnosed well at this given point in time, and they're not being spoken about in India as a skin condition, which probably come into your OPD, or something that actually requires some understanding of the world to know that these are the conditions that are not being diagnosed well, and these are the conditions that are not coming to everybody but are still for the country to know about in clinical.
What is happening now that initially, though there is a lot of awareness now, but I feel that there are some things which people don't know about, like for example pediatric dermatology. Nowadays we see a lot of atopic dermatitis in children, which was not there maybe a couple of decades ago. We have a lot of children coming with rashes, allergies, atopy, what we call, and parents are often very confused and scared when they see this kind of rash in children. So I think we need to speak about them, that awareness has to be there. Second thing is geriatric, old age skin diseases, where patients often ignore it, thinking it's just a dry rash. But dry rash could be ichthyosis. It could be related to some internal conditions. Sometimes certain kind of skin disorders, systemic disorders, just present with rashes on the skin, and it's the rash on the skin that gives us a clue that something is wrong internally. And third thing is that every rash in India is called an eczema. So people come and say this is eczema, but then eczema may look like psoriasis, psoriasis may look like eczema. So what I'm basically saying is inflammatory skin diseases, where rashes may look similar, and patient usually treated with OTC medicines until things get out of control by the time they actually come to a clinician and talk about it.
And you also see families where a rash is similar looking or a condition is similar looking, and you've seen a patient of probably a parent in the past where this has kind of been similar on a kid, but it's a separate condition and the same medication is being followed, or the same prescription is taken to another doctor which is not diagnosed well. Do you have all of this also coming into your OPD?
Yeah, sometimes what happens, a patient comes to you with a different condition, and then he gets rid of that condition, but he has that cream lying and he gets some other rash and he thinks the same cream will work. And in skin, there are a lot of things which we don't use on face, because the blood supply of the face is, it's a huge blood supply. Whatever we apply on the face gets absorbed very fast. So there are certain things which are not applied on the face. The side effect profile becomes multiple times, it increases. But the patient doesn't know this. You give him for some other body rash, he gets a rash maybe after 6 months, and he uses the same cream because he thought कि वो वाला rash improved with the same cream. So they don't want to get into the diagnosis, whether it's the same thing. And many times, yes, sometimes, but I have seen a lot of places where father had psoriasis and the child comes at a younger age with psoriasis, and which is diagnosed as eczema or simple rash or something like that. So that's the.
So, Dr. Saab, being a stalwart in the industry, probably you're the most appropriate doctor to answer this. Telemedicine has, over a period of time, grown in dermatology, and telemedicine at a given point in time, at least pre-COVID, was something that was not being encouraged. And then after COVID, then there were regulations that came into picture by the medical associations, where telemedicine was something that was to an extent encouraged because of COVID and other epidemic reasons. But at the same time, we see that there are limitations to it. So if you could help us understand to what level can a patient be using the telemedy facility, and till what extent would this also be successful, from a perspective of a clinician?
So what I feel telemedicine, one of the aspects is that rather than delaying a diagnosis, you can quickly approach somebody for telemedication, like for an online consultation. But if it's an acute condition, a severe condition, I don't think telemedicine should be the answer, because sometimes you really need to see the patient. But as a first step, just to know whether we need to address this fast, I think it's a first touch. I think that's okay. I would say that it is a good thing. And secondly, because of telemedication, I think a lot of international patients, because I think dermatologists are very difficult to avail in other countries. So that one aspect we have seen, a lot of international patients do book for online consultations, as at least to have a preliminary advice or an approach to a problem. What needs to be done? Is it something urgent? Do we need to get it? So that aspect I have seen. Secondly, I think telemedicine is very important for follow-ups, because many times patients are outstation, or patients are not comfortable coming because everybody has a time crunch. So patients want to come for follow-up, and they can, because we've already taken the history, you've already seen the patient first time, you've asked for some investigation, so it's easy. And it is also important for my time, because if my staff says we have 5 patients on telemedication and we just have to see the reports, tell them what needs to be done, so sometimes it does become easier rather than them waiting in the clinic then just for showing the report. So in certain aspects I would say it's right, and especially for remote patients, where patients are not able to get the right advice, or they are finding it difficult to approach a right doctor. So for them, I think it's definitely a blessing. But of course, everything cannot be diagnosed on telemedication, and there are guidelines that certain type of medications like immunosuppressants and all, we cannot advise on telemedication. So these are the places where patient needs to come and visit you before we prescribe the medicine. But for follow-ups, for remote patients, definitely a blessing. But the other aspect of telemedication is that we have to take care of patient privacy. Second is even the doctor safety, because every time we are taking a teleconsultation, it should be clearly mentioned that this is a teleconsultation, and we have, because the patient will be sharing the photographs and everything, we need to take the consent from the patient that he's sharing those photographs with us. Second thing is, it should also be clearly mentioned that if there is no relief with the medications, the follow-up in person needs to be done, because telemedicine cannot be replaced with visual examination, especially in case of skin. And second thing is, when we are dealing with patients who have body rashes or rashes on certain areas of the body, which apart from face and hair, then it is all the more important to have the consent in place. And also we should use those kind of consultation platforms where the privacy of the patient is completely taken care of and will not be misused ever in the future. So these are the aspects. So it is a double-edged sword. It has to be used very judiciously. We should be clear what are the patients that can be treated with telemedication and what are the patients where telemedication cannot be an option and they need to come back to us physically to show us and get diagnosed. And telemedication also needs follow-up. It's not that you've been given medications, you're going to continue them forever. You need to follow up with the doctor and stop them or continue them as per the doctor's advice.
Antibiotic resistance has been, Dr. Saab, a huge challenge in dermatology, and there has also been a lot of steroidal abuse, and this has also been taken care by a lot of cosmetologists who are non-MBBS doctors or non-dermats, where conditions like acne, pigmentation have been treated with certain kind of medications or protocols which are not well read, or they do not have as much experience. So how have you been seeing a change in your OPD and in talks that you do or you witness? What is the exact scenario right now?
The one thing that I really want to convey on this platform is that whenever we are using a cream, it is a drug. Whether you are using an antibiotic cream or you're using a steroid cream or anything you're using, it has to be used as a drug, as a medication. So once we have it clear in our minds, we will not abuse it. Now what happens is there are a lot of steroid creams which are being misused in India because of two things. They are fast acting, they've been used for generations, and second thing is that people think they can get any rash, you can get away with that. There's an acne, you put it in 2 days, the acne will go. But when they use it over months and weeks and years, they develop a condition known as topical steroid damage faces. And we have a lot of patients who come with this condition. And a lot of people, ultimately, it is very difficult to get them out of this addiction because it's like a skin addiction to a steroid cream where the skin refuses to breathe without these steroid creams. So the moment you stop them, you have rash, you have redness, you have irritation, allergy. The patient feels that, okay, I probably need that cream. The moment he uses it again, it heals the skin. So he feels this is what is helping me, and he keeps using it again and again. So I tell the patient it's like an addiction to something, anything we are addicted to, and now I have to de-addict you, and this whole process of de-addiction is going to take months together. So whenever I see such a patient, I always align the patient that this is going to be a little longer process. You have to help me get you out of this cream, and then only I'll be able to give you the kind of skin you want. See, the antibiotics that we use for acne, there are protocols, there are guidelines. They have to be used in a particular way, and they have to be combined with certain topicals also, so that we do not get the resistance or we get the appropriate results. So if we follow those guidelines, because acne and antibiotics go hand in hand, only when we misuse them do we end up, if we don't give them in optimal doses, or if we give them for short courses or very long courses, do we end up with resistance. So it is that if we give them according to the guidelines that are prescribed along with the right kind of topical medication, I think this problem will be lesser. But world over, the bacteria have become smarter than men. Every time you end up getting a new antibiotic, you have a resistance, you have a new variant coming. So I think this is an ongoing process, not only in dermatology, not only in skin. I think in medicine as such, we are facing resistance. And this is because of rampant use of antibiotics. This is too much use of antibiotics, even for smaller conditions. So we have to follow these guidelines. Whether your acne actually requires oral antibiotics or not, can it be handled only with topical treatments? And that's how we can work a little on this resistance.
Two adjoining questions. One is that a lot of people get frustrated, and in this entire process of de-addicting their bodies from the steroidal abuse that has happened or their faces, and they start using alternative form of medicine combined with whatever the allopathic medicine is what they're taking. So do you deal with any kind of patients like that, and what are the suggestions that you give to patients who have moved towards an alternative form of medicine because they've kind of given up on their bodies?
But see, I'm not a doctor of alternative form of medicine. I know it must work, it should work, it must be working. But the fact that the patient comes to me looking for allopathic treatment, I tell him what is there I have to offer. And when they say, should we take any other alternative medicine, I usually say, I don't know about it. Whenever you are getting treated with any condition, it's better to stick to one kind of science. Don't mix science. We don't know what may be affecting what in your body, where there may be interactions, drug interactions. We are not aware because we are dealing with two different sciences that work differently. So it's better to be patient, stick to one kind of pathy, whether it is any kind, and have patience, see the results in that, and then in case you feel, then you move on. But don't mix different types of therapies.
Doctor, while getting the face away from the steroidal abuse that has happened, and while you are doing an altogether a new protocol for that particular face that has got abused by too much of steroids, and the condition has kind of become very pale or sensitive, while treating a few conditions, do lasers work?
Absolutely.
Could you explain to us about a few conditions and how these lasers are effective while you're decongesting the entire system that a body has kind of gone through?
Sometimes patients who use too much of steroids get some kind of rosacea-like features on the face where there is too much of redness. So things like IPL, intense pulse light, are wonderful for reducing this kind of redness. Then we have red light, which is also helpful in reducing these kind of inflammation.
It's like an LED therapy.
LED therapy. Okay. Then also I would not only lasers, but sometimes PRP works beautifully. Because the time when the patient stops the steroid drug to the time when the patient actually the skin becomes normal is a very difficult time for the patient. Yeah. The patient can have flare-up, irritation, itching, redness, rash, photosensitivity, inability to go out in the sun, too much of redness, thin skin, facial hair, too many problems. So that time you have to handhold the patient, and you can take help of these therapies like IPL sometimes. Even microneedling helps because microneedling radiofrequency works very beautifully on grade 1 acne, which is the comedonal acne, which is a side effect of steroid therapy. Then PRPs, the vampire facials, they have this ability to heal the skin faster. So that irritation, redness, photosensitivity reduces once we do few sessions of PRP.
So, and are the pediatric needs also the same, or the protocols changes if the patients are below 18?
Usually steroid abuse we see in the later part of teenage or early 20s. I have rarely seen a child coming with steroid abuse, very rarely. And in children, there are certain non-steroidal creams also available, which help us which are anti-inflammatory. If you have a very small child who's been using steroid for rashes rather than for facial acne or anything like that, we can give certain non-steroidal treatments or protecting the barrier function of the skin or replenishing the barrier function of the skin. But usually I think in kids, we do not need to go for these kind of treatments. They usually recover faster.
And can these aesthetic treatments, especially laser hair reduction or laser toning, can be taken by children who are in their teens or preteens, or do you recommend this only when they reach an age bracket where they're adults?
For laser hair reduction, the protocol is that a female can take laser hair reduction anytime 2 years after her first periods. That is for the facial hair. And she can take body hair laser at a younger age if she is aware and totally sure of what she is getting into. Right? She should be knowing that what is this laser and everything. If she is aware of that, she can take it. Otherwise, the facial hair or the hair which is under androgens, which is under the control of hormones, that she should ideally do 2 years after she has her first period. Got it. And men, I think about laser hair reduction little late only in their life when they start going to gym and all those things.
And does this require a parental consent?
Definitely. If you are less than 18 years of age, we do need a parental consent.
Got it. So, doctor, how do you cope as a dermatologist where you're seeing so many clinical patients all the time, with social media taking a toll over a lot of dermats where, bridal is another something that is coming up. Then there is so much around Navratre, there is so much around Diwali, Dashera, Holi, where there are New Year changes. A lot of patients come asking for a Holi glow, Diwali glow. How do you cope as an enthusiast who's also to an extent visible over so many platforms and so many portals? How do you cope with dermatology at the same time so much of social media?
When we see something on social media, or when we see before and after on our social media, usually we see extreme things, somebody who's looking very aged, suddenly a jawline and all that. So one has to realize it's not possible. And if it's possible, it's not possible in single step. So what I would like to tell the patients who come for any kind of treatment, especially the anti-aging treatment, is that it's a journey. Your aging is going parallel to your treatment. Every day you are aging more and you are taking the treatment also. So it has to be a stepwise thing. It's a journey. I would like to tell you that please stick to one doctor. Don't change doctors. There are a lot of studies now to say the fillers stay on your face for multiple years. To the extent 9 years, 10 years, the fillers are still in your face. When you keep changing doctors, what happens? The doctor doesn't know, the new doctor doesn't know where all you were injected, how much you were injected. But if you stick to one doctor, usually you will be happy, you will have better results, and the side effect profile will be much lesser, because the person is entirely responsible for what he is delivering, and secondly, he knows what exactly he has done. As I said, it's a journey. You start from tightening, HIFU, thermage, you go on to fillers. It's every time you graduating from one procedure to another, and it's always with your permission or with your opinion. It's like a menu card. Everybody wants to look younger, but how much and what all do you want to do for that? And therefore it has to be a very consensual type of a thing, where you are discussing with your doctor what exactly you are looking at and whether it is achievable with what all I am planning to do for you. Right? So it's not that you get a picture which is absolutely tight and you don't want to do anything. You don't want to do fillers, threads, you just want to do a facial. It's not possible. So I think sticking to one physician is very important in anti-aging journey, because there are some things which we don't do together. One thread may react with a filler, one kind of thing may react with another, and consider it a journey. Consider it a slow journey where you go stepwise and slowly decide what all you want. Take time to decide. And then don't take your face in phases. Don't divide your face. You have to harmonize the whole face. So when you are talking to any aesthetic, any dermatologist or your plastic or anybody for your face, just remember to take it as one structure. Just don't go, I want my under eye. It is important for the doctor also to look at your face in harmony and give you what will harmonize your face the best. Also, as we know now that social media is there to stay, and it is better for us to accept the reality and be a part of this whole thing, because ultimately if you look at it, somewhere it is trying to make the customer aware and make the customer more knowledgeable. So one of the aspects of social media is that it is making our customer or public more aware and knowledgeable. So for me, I do study the algorithm, and I do understand what it wants from me, but I do not let it totally govern what I'm doing. I work on my dermatology and try and educate the patient, whether it's on YouTube or Instagram or on Facebook, depending upon what I feel as a dermatologist and as a clinical expert, what is the best advice that I can give to any of my followers or any of the viewers, considering the fact that I look at the algorithm also and I look at the clinical knowledge that I have to give. So it is basically an amalgamation of both the things, and that is what I think. My digital content is very specific. I don't put reels every day. I'm not always there, but whenever I'm there, I always try to make it
Educational in nature.
Educational and worth for whoever is watching. My digital content is limited, but whenever I make something, I always see to it that it should be valuable
And responsible.
And responsible. Yes, as a expert in a field, I want to be sure of what I'm saying and telling on digital media, and I think that's a very important thing, so that in future, anytime somebody wants to refer, they know that this is some, and I want to be known as somebody who puts out truth and the real story on the digital media, rather than a trend or something that is going around.
So, doctor, this is like a serious question. Might sound funny, but it is a serious question. If you know the algorithm well, and if you know dermatology well, would you dance for a reel?
Of course, I'll dance for the reel. Why not? You know, if the patient feels you like real, they relate to you. You cannot be always in your white coat and talking medicine. You have to be a real human. And for that, you have to dance on the reel.
So, Dr. A lot of content is being formulated over digital platforms where certain lasers are talked about. The technology has been explained by a lot of doctors or cosmetologists, but there is no addressal of actual clinical needs through these lasers. So, if you could just help us understand what are these lasers actually beneficial in while treating clinical treatments, and how are these actually to be used by a dermat, and how do the patients also recognize कि ये particular device इस particular condition के लिए है?
See, in medicine, not like one drug can be given for multiple conditions. Same way, the lasers can be used for multiple conditions. So, like for example, I was telling you, rosacea, medical condition. We can do that, help those patients with IPL. Acne is also a medical condition. There are other conditions like vitiligo, where nowadays we can use CO2 laser in vitiligo surgeries. We can use eczema laser for repigmenting the vitiligo lesions. So the same way, there are CO2 can also be used for any kind of scarring, whether that is because of some clinical condition or because of some surgery or acne or any trauma scars we can do with CO2. Surgical scars we can do, even keloids. Keloids can be done with the CO2 laser, which is again a medical condition. So medical conditions also need lasers. For example, we have this condition which is known as morphia, which can happen with the depression on the forehead. So these are the conditions that can be treated with fat grafting or with fillers, though it is a medical condition. Right? Sometimes there can be atrophy of the face because of certain medical conditions. Again, you can treat them with fillers. So for these aesthetic devices have a role to deliver best possible results with these devices, like LP, lichen planus pigmentosa. It is an inflammatory skin condition which leads to darkening of the skin, which is quite traumatizing for the patient, and it's only the Q switch laser or the pico laser which can help in reducing the pigmentation. So
I've heard that a lot of Indian skin can have hyperpigmentation where they use a pico laser for any kind of a condition versus a Q switch. Is that true?
No, it's not true. Pico laser is also good in Indian skin and quite safe. So for some conditions, pico delivers faster results as compared to Q switch laser, and together when we are doing Q switch and pico laser, we can give better results to the patient.
Doctor, body is something that is kind of moving towards a big evolution in dermatology. I have seen a lot of dermats picking up body contouring, which wasn't the case 5-7 years ago. At the same time, there were certain practices that were chain in aesthetic practices that were only doing body, and they were not focusing on aesthetics. But over a period of time, it has kind of grown. How is a dermat different in terms of delivering results when it comes to body versus somebody who's only focusing on slimming or body? That can be allopathic in terms of science or alternative form of medicine. But why is dermatology leading towards so much of body?
See, what happens is that obesity is on the rise, and we have patients who do lot of they get into this weight loss, weight gain kind of mode where they keep losing and gaining weight, ultimately leading to body parts sagging, younger patients ending up with too many stretch marks. So ultimately, you need something medical to help these patients. Some patients lose weight, but they don't lose inches, and they have these difficult to treat pockets of fat. Whatever they do, whether they are on a diet, exercise, gymming, resistance training, they are not able to get rid of certain pockets of fat. So this is where I think the major role of dermatology comes. It's not that I'm going to help somebody lose weight. What I'm going to do is to contour. I'm going to help them lose from certain pockets, and maybe with some help from dietitians also, we can help them get the kind of weight they want along with the body contouring devices. So as a dermatologist, your basic work will be to look at contouring the body, that is working on certain pockets of fat, working on loose skin when it happens with multiple sessions of losing and gaining weight, helping you treat your stretch marks, which are very common nowadays, and that's what's the job of a dermatologist in this.
Doctor Sahab, diode lasers, Alexandrite lasers, triple wavelength lasers, FDA approved 8 लाख के भी अवेलेबल हैं, 50 लाख के भी अवेलेबल हैं, 60 लाख के भी अवेलेबल हैं. किसी का माउथ पीस बड़ा है, किसी की डिलीवरी टाइमलाइंस कम हैं, किसी के अंदर कूलिंग कंफर्ट बेटर है, किसी के अंदर टाइमर्स लगे हुए हैं, कोई स्टैम्पिंग से चलता है, कोई इन मोशन से चलता है. How much should we rely on as patients on a technology stack, and how much should we understand prices for the packages that are being formed in aesthetic clinics? What is your take on how should a patient evaluate getting an LHR done or any other aesthetic treatment done when they go to an aesthetics practice or a dermatology practice?
See, I feel the man behind the machine is very important. What is the clinic? Who is handling you? Who is the doctor there that is handling you? That is very important. Machines are important, the technology is important, but if that one factor, the person who's handling the machine, giving the fluences, deciding which laser you require, is not taking the right decision, you can never get good results. Mm-hmm. And as far as the devices are concerned, see, the market is full of lot of devices, and I'm sure the clinicians take consideration, they do consider what devices they want to buy depending on various parameters that are there. What are the lasers, the lights, the company, what is the credentials of the company, all these things are taken care of. So I'm sure if you have the right kind of person, they would have considered all these considerations before allowing a device in their clinic.
But do you think somebody who is a perfect clinician who understands the skin condition कि dark skin पर ये work करेगा, light skin पर ये work करेगा, या फिर fine hair पर ऐसा work करेगा, can do justice with an 8 lakh rupee laser versus something that is a 50 lakh rupee laser?
See, it's like having different kind of cars, right? The difference will always be there. That is why the technology is upgrading. You know, we started with diode, we started with NDAC. Today we are at triple laser. Today we are looking at heat and RF trying, because somewhere the lacuna is there. You know, a patient doing laser for hirsutism may not have complete hair reduction after 6 sessions. So that means that lacuna for the right kind of results is an ongoing process. And that is why I think the right kind of technology is yet to come. You know, until it's evolving so much that, but definitely the difference is there. You know, you cannot undermine that thing. The difference in technologies, the companies, the costing, if the cost is so different, the technology is different.
Doctor, for example, somebody has paradoxical growth and who's a PCOS patient and who has some fine hair coming in for lifetime. And then the debates are going on between what is laser hair reduction, what is laser hair removal, versus all of this content that is doing so much hodgepodge in the head for a patient who's actually suffering from PCOS. Should the patient rely more on the technology stack or the clinician?
Clinician. Because I tell you, I have been working with lasers since 2006. And I tell you that over time we understood why a patient is getting paradoxical hair and how it can be prevented. Whatever technology you use, the best of technologies can give you paradoxical hair until you do not have this criteria or these guidelines, or if you are not aware how to prevent. Person behind that who decides the fluence is very important, irrespective of whatever technology you are used. Paradoxical hair reduction is not something that comes because of the device. It comes how you did the laser and did you take those precautions which are mandatory to prevent paradoxical hair reduction or not.
A lot of debates have been going on where exosomes are said that they're not US FDA approved. While doing regenerative medicines, there is a lot of experimental medications also happening because there is so much new that is coming in. How much do you think an FDA approval should we rely on, and what is the combination that you would want to stick on? Would it be something that is being done in the past for a very long time with something new that is coming in, or would you want experiments to wait and do a combination of something that was already being done?
See, it depends on how much the molecule has been studied, how many clinical trials, white papers are there to back whatever you are introducing in your clinic. FDA approval is there for many things, like it is for application, maybe not for injection, but it is there. And I think, and then our own clinical use will also help us decide. A basic thing like melasma, people are struggling with it, not finding an answer. Maybe regenerative medicine has an answer, and we will be able to help people with melasma. So I think I am definitely very enthusiastic about regenerative medicine, and I would really like to see what it has to offer us, because probably the answer is there. Regenerative medicine is going to be it is the next thing. It's there. And the only thing is control. Whether the right kind of products, and are we doing, it should be like clinically tried, tested. The data should be there where exactly all these products are coming from. Ultimately, the regenerative medicine is there to stay. We see how much exosomes have made a difference. We are seeing so much happening in the world of PRP. What is it? It's a regenerative medicine. Your own body cell helping you heal. So this is the most basic regenerative medicine we are talking about. And as the time will go, we will have much more in regenerative medicine.
Doctor, thank you so much for giving us insights. Being an industry stalwart, there were so many questions that were still unanswered, and I've just loved this session with you. But before we end this, हमारे शो की एक प्रथा है, हम एक रैपिड फायर करते हैं जहाँ पे हम अपने गेस्ट्स के बारे में और जान पाते हैं, उनकी नॉलेज के बारे में और उनकी लाइफस्टाइल के बारे में. So, are you ready for it? One skin condition you think that will rise drastically in the next decade?
Allergies.
The most overused skincare ingredient today?
Niacinamide.
The most overused skincare ingredient that is being used today? Sorry.
Niacinamide.
The most overused skincare ingredient today?
Niacinamide.
A dermatology tool you absolutely can't work without?
Dermatoscope.
One clinical skin condition you find most challenging to treat?
Autoimmune diseases.
If you weren't a dermatologist, what would you be doing?
An art person, maybe a writer or a singer.
The first thing you notice when a patient walks into your clinic?
How well they take care of their skin. I just guess it. I say, is she the one who uses products or not? And then usually I'm right.
One piece of advice you give almost to every patient?
Trust your doctor.
One skincare habit you personally never skip no matter how busy you are?
Sunscreen.
If you had to choose cure acne forever or reverse aging completely, which would you pick?
I like to do them both.
Thank you so much for being a part of this show. I'm so excited to get this edited and roll out amazing answers that I've got from you. And I really wanted an industry stalwart on board so that I really make my viewers understand what's next in dermatology. And I'm really grateful.
Thank you. It was a pleasure being here, and I think I loved the experience myself.
Thank you. तो दोस्तों, आज के लिए इतना ही. डॉक्टर मोनिका से बात करके बहुत कुछ सीखने को मिला. अगर आपको ये कॉन्वर्जेसन पसंद आई हो तो सब्सक्राइब करना ना भूलिए, शेयर करना ना भूलिए अगर आप इस चैनल पर नए हैं, और कमेंट करके बताएं कि आप नेक्स्ट एपिसोड किस टॉपिक पर देखना चाहते हैं। और हाँ, चैनल को सब्सक्राइब ज़रूर करें, इससे हमें मोटिवेशन मिलती है और हम ऐसे ही और इंस्पायरिंग कॉन्वर्जेशंस लाते रहेंगे। मैं हूँ तनय तुलसानी, मिलते हैं जल्दी एक नए एपिसोड के साथ, तब तक के लिए जय हिंद।